Let's talk about review. Part B helps to cover doctor visits, ambulatory surgery, that's outpatient surgery, ambulance, ER, outpatient labs, imaging, and tests, and infusion meds and chemotherapy. If there's a few things I want you to take from here with you, and that's one of those things. Chemotherapy, even though it involves drugs, is a Part B thing. It's not a drug thing. It's a Part B thing. So that might be important for you to remember in the back of your mind someday. What does Part A and B not cover? It doesn't cover prescription drugs. It doesn't cover routine dental, vision, and hearing. It doesn't cover care outside of the United States. Think about it. It's a federal program. It doesn't cover long-term or custodial care. So if you're thinking about Medicare helping you with nursing homes, they're not going to be there for you. You got to have another plan for that kind of thing. And custodial care, that's just like basic stuff that we have to do, like eating, bathing, getting dressed, all the stuff that we have to do. And Medicare doesn't help with that kind of thing. They do help with home health care, but they don't help with custodial care. Those kinds of things are important too. So you might want to have a plan for if you need that kind of extra help. If you've ever been a caregiver before, you know there's not enough of you to go around. Even if there's two of you, there's not enough of you to go around. So having someone who can come in and help you for a few hours a week or a few hours a day can really be a lifesaver. There is such a thing, this is not a Medicare thing, but there is such a thing as a home care policy. They usually run for about a year. They're not terribly expensive. They're a lot cheaper than long-term care insurance. So keep that in mind. If you find yourself in a situation where you think you might have that need, call me. Just remember that we had the conversation, and I'll give you some guidance on that.